Older people need to think about several things when they're trying to select a physician. First of all, they need to have somebody that they're comfortable with, that they can interact with, who they feel takes them seriously, spends enough time with them, will answer their questions.
In choosing a particular doctor, I think it's important to make sure that it's a physician that likes to take care of older people. And you can just ask your friends, or you can ask the patient's office, the doctor's office staff, or you can ask the doctor to see if he likes older patients. Not all doctors like to take care of older people.
Choosing the right doctor is good for your physical well-being as well as your peace of mind. And there are a few important steps in selecting a doctor. However, your choices may be somewhat limited if you are in a Medicare HMO, since you will need to choose from their physician list.
Selecting a physician is a really key area, I think. And even though with Medicare managed care and different HMOs, we'll probably all find that there's some restrictions in terms of a group of people we can pick. But I think really interviewing your physician, coming up with what it is you feel like you want from a healthcare provider is important.
Perhaps the most valuable recommendations come from talking to your friends and your family. You can also call the Area Agency on Aging or your county or city medical association and ask for a referral to physicians in your area. Those numbers are located right in your local telephone directory. When you have narrowed down your selection to a couple of choices, schedule a brief interview just as you would with any service provider. Even if you have to pay a small fee, it's probably worth the cost to make sure you have a doctor with whom you can feel comfortable. If you cannot afford to pay a fee, explain that to the doctor's nurse. Perhaps you can visit the office and have the office staff answer your questions about how the doctor's practice works. You may want to ask if they accept assignment from Medicare. If they do, they will bill Medicare and accept the amount that Medicare deems reasonable and customary. You will only pay your Part B copayment and the deductible. If the doctor does not accept assignment, he can bill you over and above the reasonable and customary charges to a certain limit. Also ask if they accept your insurance or are a provider for your HMO before scheduling your visit.
To find out if a physician is credentialed or board certified, there's a number of ways that you can do that. The local medical society can certainly tell you. They usually have lists of all the local physicians, and they can tell you their training and what certifications they have.
You may want to take time to evaluate the hospitals in your area. Call the ones in your community and ask them the percentage of doctors who have privileges there that are board certified, the percentage of registered nurses per bed, so you know what percentage of nursing care is being provided by nursing assistants, and if they have special services like a senior program. Ratios and percentages will vary from area to area, so you may want to select the hospital that has the best percentages and ratios for your particular community. If you have a strong preference based on your evaluation, you need to make sure your doctor has privileges there. If you feel strongly about this issue, you may want to choose a doctor who has privileges at that hospital.